Good morning, everyone. So we are back again to get to know our PNWC 2025 speaker. So good morning po, Doc. First, can you please introduce yourself and tell us where you're from?
I am Rosano Locsin. I'm originally from Dumaguete City, and I am now Professor Emeritus of Florida Atlantic University.
How do you think this Congress can help bridge culture and elevate the quality of care worldwide?
One of the main concerns that I have about technology and caring is its valuation as far as culture is concerned, right? And so the important thing is, how can we use technology as a bridge to cultural gaps? And that was the focus of my presentation yesterday. And so the important thing is understanding who you are as a person, right? And in doing so, you understand that perhaps my way of nursing is specific, unique, and therefore must be also understood. It's not only us that should adjust to what is the culture of the other area, shall we say, but the cultures of other areas should also be informed that this is who we are as a person. That can be easily bridged through technology.
Can you please tell me more about yourself and tell me where you're from, sir?
Okay, so I'm Judd. I am an associate professor in the School of Nursing at Hong Kong Polytechnic University. So my role is I am associate head of strategy for the school. So I look after international engagement, school promotion, student exchange, and the like.
Inspired you to pursue a career in nursing?
I found nursing as something that would open opportunities for me. And what I mean by that is because I've met nurses who are working in different fields. So nurses who are teaching, nurses who are working in the hospitals, in the community. So there's lots of options. So when I thought about it, okay, if I'm going to be a nurse, I will spend time working in the hospital, but also there are some opportunities outside the hospital environment, which in my case now I'm teaching in the university.
So, sir, can you please introduce yourself and tell us where you're from?
From Australia. I'm Dr. Jerome Babate. I'm the Executive Director of the Filipino Nursing Diaspora Network. We are an international organization of Filipino nurses, and our mission is really to connect Filipino nurses worldwide, and our estimated number is actually more than 1 million.
What inspired you to pursue a career in nursing?
I can remember that in 30 years ago, I was encouraged by my parents to pursue nursing on the pretext that it has potential employment opportunities in the United States. And so that was actually the impetus of enrolling in the nursing program. First nursing work was into mental health nursing, because I was the center director for Mahintana Rehabilitation Center in Jensen. So I started that institute. It's now an institution. After that, I went to academia, teaching in as a part-timer in nursing leadership and management, and I also doubled in the business course program because I have an MBA degree.
Since you're one of the people behind the scenes of this event, so can you please introduce yourself, ma'am, and tell us where you're from, po?
I'm Dr. Patria Villacorta Manalaysay, and I'm from Davao. I am the lead convener for Philippine Nursing World Congress. I belong to the PNSO, the Pacific Nursing Service Organization.
So can you give us an idea or insights to what is the purpose on why this event was established in the first place, po?
This is the initial program that we have for most especially the Mindanaoans. And in this part of the country, we would like to highlight and celebrate Filipino nurses. Now, with this initial program that we have, we invited leaders, nursing leaders in particular, to speak about the good things that happen to them in other countries. And so they're here to share everything from knowledge to their practice, their experiences, and so we get a good glimpse of the whole picture of the impact of Filipino nurses.
So we are here today for one of the speaker and panelists of this event. So sir, how is your experience here in Davao City?
Well, Davao has actually been a very fun place. It's actually my first time being here in Davao. I haven't traveled much while I was here in the Philippines, so it was pretty exciting.
Can you please introduce yourself and where are you from?
My name's Glenn. My full name's Glenn Nestor Chua. I'm currently working as a clinical nurse educator in Sydney. However, I was trained as a nurse in Cebu. So I finished my Bachelor's of Nursing in the University of the Visayas and retrained in Australia, and I started working there.
What impact do you hope your talk will have on the nurses attending PNWC 2025?
So yesterday during my talk, I was actually talking about advocating for technological advances in nursing, mainly things that we can improve from a technical perspective here in the Philippines. The main point of my talk was basically political advocacy. Filipino nurses are being known to be very quiet, very timid, very shy. I wanted our nurses to step up their game and to advocate policy changes, especially regarding promoting telehealth and virtual health among the Filipino communities, with the hopes that in the near future, with all the infrastructures in place, we could probably set up telehealth centers in far-flung areas, which they would definitely need that more than the people living in the city.
Can you please introduce yourself, sir, and tell us where you're from?
So my name is Dr. Jose Arnold Tariga. I am currently based in Boston in Massachusetts, but I'm originally from Bohol. So I'm really Bisaya by heart, but right now my current role is a nursing professional development specialist, and I oversee the training of our international nurses who are moving to the United States.
That's great, sir. And not to be biased, I'm also a Boston Celtics fan, so send me my regards, sir. How do you think this Congress can help bridge cultures and elevate the quality of care worldwide?
Personally, I think the main thing that this Congress has done in terms of bridging, culturally fluent nurses worldwide is really the knowledge sharing that we are getting from a lot of the speakers that we have. This conference is very much well attended by local and international nurse leaders and nurses, and with that we had the opportunity to actually really exchange some of the insights that you can learn locally but can also actually apply globally. And it's the same goes the other way around as well. As a nurse who's now based in the United States, and with nurses as well that are based from different parts of the globe like Australia, Canada, I've also really learned a lot of different insights, and that just shows how culturally fluid and culturally fluent we are as fellow Filipino nurses, especially as we move from the Philippines to other parts of the Philippines and even other parts of the globe too.
Sir, may we know your name and where you came from?
So actually, my name is Rodolfo de la Semosa Jr. I am originally from Cagayan de Oro City, but I live already in Toronto, Ontario, Canada for 14 years, and there I am the Associate Director of Care of a long-term care facility, as well as the first Asian President or Council Chair of the College of Nurses of Ontario, which is equivalent to a Board of Nursing or the Professional Regulation Committee, which is a nursing regulatory board for nurses.
Grabe, ang daming credential. How about naman dyan, partner?
So how about you, sir? Can you introduce yourself, sir, and tell us where you're from?
Yes, I'm Rodson Barcoma. I'm originally from Cebu, but I am from Perth, Western Australia as of the moment.
So, sir, what inspires you to choose this career path, especially in nursing?
I think nursing is really my passion and it's my call. Ever since I was a child, I really want to, serve and help, patients, people who are sick or having illnesses, and it really fulfills my dream and fills my heart that somehow I could provide service. I could touch people's lives through my, with my hands, through rendering my care to my patients.
What impact do you hope, sir, your talk will have on the nurses attending this Congress po?
Nursing empowerment. That's the first and I think the most important, especially in our setting in the Philippines. We want to get out of the notion that nurses are just the handmaidens of the doctors. Nurses are more than that. We are experts on different fields. We are the forward leaders of innovation in different sectors of the nursing field. So that's what I think is the most important thing that we are doing right now in this convention.